Hey guys, this is Dr. Marcus here at Alvarado Healthcare. Just wanted to do a quick video today. I wanted to show what it means whenever you've gotten an x-ray done that shows a loss of cervical curve, loss of cervical lordosis, or just that neck curve has disappeared. So what does that mean? Okay, so if you look behind me here, I have an image of a woman here. Okay, and I'll turn around. All right. So as you can see here, our body has different curves, okay? So we've got a cervical curve, so cervical, which is our neck, 7 vertebrae there. We've got our thoracic curve, a lumbar curve, sacral curve, okay? So different curves of the body, and they're there for different reasons, okay? So today we're just gonna talk about the cervical curve or the neck curve. So that's gonna be this top section here, those first 7 bones, okay? So this cervical curve goes right through here in our neck, and we've got an x-ray view right over here, okay? So notice this is normal. This is a textbook spine. We've got a nice reverse C shape here, a nice curve there. Now what happens is a lot of times this curve gets lost, okay? Typically that's from an accident. It can be from a car accident, it can be from a fall, repetitive damage, or also sometimes people just are born with a neck that just tends to not have that curve, okay? Our bones move because of the directions that muscles pull them in to some degree. So whenever you do have that loss of cervical curve, that can be caused from a variety of different things. So we're talking about the neck here. We've got our C-shaped neck up here, and the x-ray looks like that, all right? So what happens is that the reason we have this nice reverse C shape here is to provide stability from different motions. It helps to distribute forces. So from walking, twisting, turning, jumping, we have a nice reverse C shape. So that helps distribute the forces. Now the issue is when you have a straight cervical curve or a loss of cervical curve or lack thereof, what happens is that becomes like a pogo stick. And the way I explain it to patients is a pogo stick is straight up and down so that when you hit the ground, you can jump up into the air as high as possible, absorbing as much force as you can. So with a pogo stick, that's really fun, that's great, that's exciting. But for your neck, which supports your head, that can be problematic. So what I see most commonly is patients with a reverse cervical curve actually tend to have a lot of headaches because a lot of the force isn't distributed properly, causing a lot of force to go actually into the head, causing headaches, neck pain, different things like that. So if you again look at the image here, we've got a nice reverse C shape there. If you go down here, you notice a straight cervical curve, okay? Just going straight in a line. So these are the vertebral bodies, or these are the bones of the neck, and that causes a nice straight line here as opposed to a nice curved line that you can see in this normal picture above, okay? So what happens, this person, they tend to have headaches, neck pain, chronic neck pain, and a lot of other issues. So what's great to know about that is these are things that we treat in the office. Chiropractors definitely will treat many neck related issues, headaches, a variety of different things. So mostly just working on the muscles, adjusting the joints, and doing everything we can to get you to feel better. I would say most patients with some kind of reverse cervical curve, although it does take anywhere from weeks to months to fix, doesn't always mean that those are what's causing your problem. Just because you have a loss of cervical curve doesn't necessarily mean you're going to have pain or headaches. I myself, the last x-ray I took demonstrated a loss of cervical curve, which I was excited about because it makes me a little taller. But also I don't get the headaches. I don't have a lot of neck pain. I do a lot of things, at-home exercises, stay fit, stay active, proper diet to help keep things in check. But for those who may fall short in some of those things, it's always good to get it assessed. Headaches are not a normal thing. They're not something that you should be experiencing on a daily or even weekly basis. A lot of people, think these things are normal when they're really not. So getting those checked, by a chiropractor or any kind of professional to see what can be done about it is always what I recommend. And then kind of biased here, but I always recommend a more conservative treatment prior to more invasive things, such as some medications or even surgical consult, things of that nature. So again, just get back over here. We've got the normal cervical curve. So this is cervical, this is the neck. We've got the 7 bones here, C1 to C7. So what you want is a nice C shape. If we come over here to the X-ray, we can see normal curve here and a nice reverse C shape. So that helps for dispersing forces. That's the way that the muscles should be contracting in the back of the neck here. So you can't see the muscles, but they would be right back here, providing nice support for the neck there. Now what happens if we lose that cervical curve, it becomes straight, as you can see here. This is talking about degeneration. That can be caused, certainly with a straight cervical curve here. So this is a straight line here. You can see the front of the vertebral bodies or the bones in your neck. They just make a nice straight line. So these muscles are going to be a little dysfunctional here, potentially, not always, but they can be. And again, that leads to headaches, neck pain, aches and pains, a lot of things like that. So certainly if this is something you're interested in getting checked, we deal with this stuff in our office almost on a daily basis. We get really good results working on that. If you do have any questions, feel free to let us know. We're always here to help. Thanks for watching, guys. Have a great day. Oh, how can I